Iyiola Omisore declares intention to contest Osun State 2026 governorship election. Nigerian military arrests 450 terrorists, rescues 180 kidnapped victims in September. The Nigerian police says it is yet to receive court order bearing enforcement of tinted glass permits. Another foreign Peter Mutharika sworn in for second term as president of Malawi. Good evening, this is News at 7 on West Spring Television. My name is Tomilola Daniel Adejuwon. A chieftain of the All Progressives Congress, Senator Iyiola Omisore, has announced his intention to contest the 2026 governorship election in Osun State under the platform of the APC. Omisore, a former deputy governor of the state, made the declaration in a post on his X handle on Saturday, saying the formal announcement would take place on Tuesday at the state's APC secretariat in Ogoluwa, Osogbo. It discloses that he decided to formally declare his intention to contest for the state's #1 seat after deep reflection and wide consultations. He said his campaign will focus on restoring hope, strengthening governance, and delivering a brighter future for the people of the state. Omisore, who served as deputy governor of Osun State between 1999 and 2003 under the Alliance for Democracy, later became a senator representing Osun East from 2003 to 2011. To security matters, the Defense Headquarters at DHQ has said military operations arrested at least 450 terrorists and rescued 180 kidnapped victims during ongoing internal security operations in September. The military high command said 39 terrorists surrendered to the military, while various calibers of weapons and ammunition were recovered from the insurgents last month. The Director of Defense Media Operations, Major General Marcus Kangia, revealed this in a statement on Saturday. General Kangia said the operations were executed under different joint task forces, including Operation Hadinkai, Operation Fasanyama, Operation Enduring Peace, Operation Wellstruck, Operation Delta Safe, and Operation Udoka. According to the defense spokesman, troops recovered 63 assaulted arms, 4,475 rounds of ammunition, and 294 items, including grenades, improvised explosive device materials, motorcycles, vehicles, and handheld radios. He added that the armed forces remain committed to transparency, accountability, and the lawful execution of all missions in accordance with international and domestic rules of engagement. The Armed Forces of Nigeria on Saturday said it arrested 6 officers for alleged indiscipline and breach of service regulations. The military said investigations showed that the grievances of the arrested officers were linked to repeated failure in promotion examinations and perceived career stagnation. According to a statement by the Director of Defense Information, Brigadier General Tuho Guso, the conduct was described as incompatible with military standards. He noted that some of the officers had been under jurisdiction for various offenses and were either waiting for or undergoing trial. He stated that those indicted at the end of the investigation would face the military disciplinary process in line with established procedures. He assured the general public that the actions are strictly disciplinary in nature and part of routine efforts to maintain order, discipline, and loyalty within its ranks. He further stressed that the military would not tolerate behavior that undermines its integrity or threatens its constitutional role. In the meantime, former Nigerian President Goodluck Jonathan says the abduction of the Chibok girls remains an indelible scar on his legacy. He spoke on Friday at the public presentation of Scars, Nigeria's Journey and the Boko Haram Conundrum, a memo by former Nigerian Chief of Defense Staff, General Lucky Irabo. The former president praised General Irabo's service, noting that the retired officer was a soldier who stood for truth and never played politics with security. Reflecting on his presidency, Jonathan admitted that the 2014 abduction of 276 schoolgirls in Chibok, Borno State, would haunt him forever. He stated that no plastic or cosmetic surgeon can remove it, adding that it was a scar he would die with. The incident sparked the Bring Back the Girls hashtag campaign and global outrage. Although some girls escaped on or were freed, over 80 still remain unaccounted for. Jonathan recalls that Boko Haram began in 2009 when he was vice president under Umaru Musa Yar'Adua and intensified under his rule. He further stressed that the insurgency is far more complex than many assume.
White, black is black. Thank you, you're a gift to this country. And the title of the book is quite interesting, Scars and the Boko Haram Conundrum. It is interesting because, when I was in office, and one of the major scars on my government, and would be on my face, and like Bishop Cook has said, no plastic or cosmetic surgeon can remove it. It's the issue of the Chibok girls. It's a scar that I will die with. But later on, people may know a little more details. And that's also to do with the Boko Haram. What do they really want? Of course, our chairman raised the issue when interviewed some of them, and they gave him some perspective. But probably one day, I pray that some of the Boko Haram leaders may be literate enough to document. The Boko Haram started 2009 when I was the vice president with late Yar'Adua. Of course, I took over 2010 for 5 years, battling with the Boko Haram until I left. I thought that immediately I leave, within a reasonable time, late General Buhari was going to wipe them out, but till today, Boko Haram is still there. So the issue of Boko Haram is a little more complex than sometimes we can conjecture. In 1999, when Obasanjo became a president, we had some issues in the Southwest. But government was able to bring it down because there was a clear focus, there was a clear reason, and government was able to. Then we had issues in the Niger Delta. And when I became the vice president, one of the major things I did was to visit the most dangerous camp of the militants in the Niger Delta. I remember when we flew down to Warri, by the time we get to the waterfront to take boats to that camp, they sent information to us that anybody following me must not carry weapon. My ADC, my CSO, that nobody should carry a weapon. In fact, the Commissioner of Police of Delta State said, Vice President, no, you will not go there. The State Director of SSS to say, no, I will not go.
Nigeria Police Force Border Patrol Unit has intercepted and recovered over 100 jerrycans of premium motor spirits BMS, commonly known as petrol, which were about to be legally transported across the nation's border. A statement by the Force Public Relations Officer, CSP Benjamin Hundeyin, on Saturday said the feat was achieved while officers were on a stop and search duty along Ilela-Sokoto Highway. According to him, operatives of the unit intercepted a vehicle loaded with 80 jerrycans of BMS and arrested the driver, Yasir Adam. However, after preliminary investigation, it was discovered that the suspect was attempting to smuggle the petroleum product across the border into Niger Republic. In a similar breakthrough, CSP Hundeyin said the operatives of the unit in Katsina State intercepted 35 jerrycans, each containing 25 liters of PMS, which were to be transported into Niger Republic. It is close to that the suspect, on sighting the team, abandoned the exhibits and fled. The police image maker further added that efforts are ongoing to apprehend the suspect and bring them to justice. Moving on, the Nigeria Police Force says it has yet to be served with the order of the Federal High Court stopping the enforcement of tinted glass permit. The Force Public Relations Officer, CSP Benjamin Hundeyin, disclosed this on Saturday while reacting to report that the court sitting in Warri, Delta State, had restrained the force from arresting or prosecuting motorists over tinted glasses. A federal high court on a Friday granted an order directing the police to suspend enforcement of the permit, pending the determination of the substantive case. The order asks the police to maintain the status quo, halting any action against motorists until the matter is concluded. But Udayi, in a post on X, said the police had not been formally served. The clarification followed claims by human rights lawyer Enibe Efyong, who had circulated the portion of the ruling restraining the police from enforcing regulation. In another development, the Federal High Court sitting in Abuja dismissed a suit filed against the President of the Senate, Senator Akpabio, challenging the legality of the 6-month suspension imposed on Kogi Central Senator Natasha Akpoti-Uduaghan over alleged misconduct. The suit filed by Ovavo Iliyasu and 9 others, but was dismissed by Justice James Omotosho on the grounds that the plaintiffs lacked local standing to bring the matter before the court. The suit contested the validity of the suspension of Natasha Akpoti-Uduaghan for various reasons. Among other things, the plaintiffs asked the court to avoid the suspension on the grounds that their senatorial district would be shortchanged and called for her immediate recall. Delivering judgment on Friday, Justice Omotosho held that the 10 plaintiffs lacked local standing to institute the action and subsequently dismissed the suit for lack of merit. Meanwhile, Senator Akpoti-Uduaghan returned to office at the National Assembly on September 23 after a 6-month suspension. The suspension, which began on March 6, was imposed over an alleged violation of Senate standing rules. Talking health, the Nigeria Center for Disease Control and Prevention and CDC has confirmed that Lassa fever has claimed 168 lives across 21 states in 2025. In a situation report for Epidemiological Week 38, the agency revealed a total of 4,543 suspected cases, of which 897 were confirmed positive, with a case fatality rate of 18.7%. The NCDC noted that 4 states, Ondo, Edo, Taraba, and Bauchi remain the epicenters of the outbreak, accounting for 67% of all confirmed cases. Other affected states include Ebonyi, Benue, Kogi, Gombe, Plateau, Kaduna, Nasarawa, Enugu, Delta, Anambra, Rivers, Borno, Oyo, Ogun, the Federal Capital Territory, and Lagos. The report also highlighted that most of the confirmed cases were among people aged 21 to 40, with both men and women affected. Lassa fever is an acute viral hemorrhagic illness transmitted to humans through contact with food or household items contaminated by the urine or feces of infected rats. Vaccines are only as effective as the systems delivering them, and in Osun State, where many communities once faced long, uncertain journeys to the nearest clinic, a growing network of revitalized primary healthcare centers is changing the narrative. Olalikon Akindoji reports that with solar-powered facilities, the better drug supplies, and a closer link between antenatal care and child immunization, the state is seeing real results.
Oluwaseyi Omoni cuddles a 15-month-old child as she presents him at the primary healthcare center in Osun, a town in Irekpodun local government of Osun State, for another dose of vaccine.
It's easy for me because my house is nearby. It's not far from this place. I will not take any Okada or bus to come here because it's at the back of my house. That is why it's very easy for me and every one of us here.
Across Osun State, more families are being connected to the primary healthcare system, and mothers are bringing their children for vaccination through a link with other essential services like antenatal care and screening. Through an integrated vaccination campaign, eligible children, pregnant women, and other residents of the state are also benefiting from integrated health services. In the past 2 years, the government says it has completed the upgrade and renovation of over 200 primary healthcare facilities across the state, each one situated in a ward, thereby bringing healthcare closer to rural areas and helping to expand vaccination. The revitalized health centers were equipped with solar panels to ensure 24 hours water and power supply, as well as provision of drugs through the Osun Primary Healthcare Board. It's a Wednesday morning in Osun, Egbedore local government of Osun State, and the PHC in the town is filled with children and young people who have come for vaccination. Tomilola Adebayo has come to take the human papillomavirus HPV vaccine aimed at preventing cervical cancer. She says the process has been made easier by the availability of a functional PHC in the town. Success Oyelowo also brought a 3-month-old baby to the PHC for routine immunization.
Every child has this particular card called immunization card. A date is being written, given to every parent, which indicates the date a particular child is to take that immunization.
According to the World Health Organization, WHO, immunization currently prevents 3.5 million to 5 million deaths every year from diseases like diphtheria, tetanus, whooping cough, influenza, and measles. Findings suggest that Osun State has a low zero-dose prevalence compared to many other states. And according to the Nigeria Demographic and Health Survey, NDHS, in 2018, 17.2% of children aged 12 to 23 months were fully vaccinated according to the national schedule. This rate jumped to 41.2% in the 2023-2024 NDHS survey, showing a 24% increase. However, this still falls short of the WHO's 80% target.
In the time past, it's lagging somehow because people are not getting to have the understanding.
Head of the Nigerian Red Cross in Osun State, Tolulope Ogunleye, believes the state government investment in primary healthcare centers has made it easier for residents to have access to vaccines.
If you have vaccines at our cold chain co-room and there's no health center to take them to, how will our people be beneficiary of these vaccinations? So that's why I said, linking it together, we have vaccination, availability of vaccines, then we have healthcare centers to take them to. So that brings the connectivity. On the 12th of December 2024, Osun State emerged as the Southwest champion of the Primary Healthcare Leadership Challenge Award with a prize of $500,000, an amount expected to be further invested in the PHCs. Across several towns in Osun State, many residents seem to now have access to vaccination. This is due to the expansion of the primary healthcare system across the wards of the state. However, some issues still remain. Osun State has 332 wards, and the government's claim of renovating and revitalizing 200 PHCs means there are 132 wards yet to be reached, though the state governor, Ademola Adeleke, earlier promised to ensure the rest were completed in 2025. Fatima Raimi is a resident of Egbedi Town, Egbedore local government area of Osun State. The aged woman who stood in front of the community's dilapidated health center wants the state government to extend its PHC renovation drive to the town.
While
access to vaccination has improved in Osun State, Fatima's concerns are important as the renovation of 200 out of 332 PHCs means some communities still have limited access. Rural and hard-to-reach areas still lack functional centers, leaving gaps in equitable service delivery. There are also issues around staff availability, medical equipment, drug supplies, cold chain facilities, and some other essential services. The state government must also put up a sustainable plan to ensure the renovations and upgrades are maintained in the long term, most likely through budget provisions. Tolulope Ogunleye, who heads the Nigerian Red Cross in Osun State, also says there are other challenges.
When you get to some houses, to orientate them, to sensitize them by particular disease, they say, I know in our church, in our mosque, they say we should not take such. That is one. Two is cultural belief. Some say in our own lineage, it is Agbo we take.
Olalikun Akinoju, Western Spring Television News.
You're watching News at 7 on Western Spring Television. Still to come, Dangote cement truck crushes 5 people to death in Osun State. We'll bring you more on this when we return. Please stay with us.